What is the surgical treatment of retinal detachment? The eye is very similar to a camera with lenses at the front and photographic film at the back, and in between the two, in the body of the camera, is a clear jelly called vitreous. In some people, as the jelly ages, it becomes more watery and the jelly eventually pulls away from the back wall of the eye. Once it pulls away from the back wall of the eye, in a small number of patients, the jelly does not want to let go of the retina and tugs on the retina and creates a retinal tear. When a tear develops in the retina, the watery component of the jelly goes underneath the retina and the retina detaches from the back wall of the eye. This requires a formal surgical procedure to fix. The operation is usually an operation called a vitrectomy, which involves removing the jelly from the eye cavity, and therefore the jelly that has pulled on the retina, creating the tear in the first place, is physically removed with a very fine probe that cuts away the jelly. Once the jelly has been removed from the eye cavity, the retina has to be pushed back into place, and it's pushed back into place pneumatically by placing a gas bubble inside the eye, which pushes the retina back up against the back wall of the eye. Once the retina is in its normal position, the tear that caused the retinal detachment in the first place is spot welded in place by applying some laser treatment to surround the tear. The way the laser works is it creates inflammation, and that inflammation then converts to scar tissue, and it's the scar tissue that actually binds the tissues together and seals the tear. And this takes a few days. So it's very important whilst this process is occurring for the retina to remain in its normal position, and this usually means that you have to posture to get the gas bubble inside the eye to press up against the retina and up against the tear. This may be posturing in an upright position, face down or on your side, depending on where the tear is and how many tears there are. Most patients with retinal detachment have this procedure, vitrectomy and a gas bubble, and the gas bubble then slowly absorbs over a period of usually between 1 week to up to 6 weeks, depending on what gas is used. Occasionally, oil is required if scar tissue is forming inside the eye, causing a more severe form of retinal detachment. And sometimes a retinal detachment is fixed not by going on the inside of the eye with removing jelly and putting a gas bubble in, but by placing a piece of plastic on the outside of the eye to push the layers in to seal the tear. And this is normally seen in association with patients with younger patients whose jelly has not yet become watery. The success rate of retinal detachment is that approximately 9 out of 10 retinal detachments should reattach with one operation, and the serious complication associated with retinal detachment is excessive scar tissue forming, which can pull the retina off again, requiring further surgery, and this occurs approximately 5% of the time, depending on the severity of the detachment in the first place.